thank you everyone for joining us today. Maybe we'll just give it 2 more minutes before we get started. Feel free to introduce yourselves if you feel like it, going on the mic or just in the chat. Just a heads up that this event is being streamed live on YouTube. So if you would prefer your face not be shown on the internet, you can turn the camera off. Yeah, feel free to also share in the chat where you're joining from, what institution or province. Okay, let's maybe get started. Thank you everyone for joining us today, and happy Social Prescribing Day. Yeah, very excited to have people from all across the country here tonight. Yeah, especially for folks on the East Coast, thanks for joining us this late. My name is Jeffrey Wong. I use he, him pronouns, and I'm one of the co-leads here at the Canadian Social Prescribing Student Collective. And yeah, I'm going to pass it over to the rest of our team to introduce themselves. Margaret, do you want to go first?
Sure. Hi, everyone. Happy Social Prescribing Day. Thank you so much for joining. My name is Margaret. I'm a nursing PhD student from BC, and I'm one of the co-lead as well on the team. And I'm going to pass to Élyse.
Hi, everyone. Élyse McCall-Thomas. I'm a PhD candidate at the University of Ottawa in the Faculty of Education. And I've been working with the leadership team for just over a year now, doing a lot of sort of more of the admin, behind the scenes kind of things. And I'll pass it to HanShu.
Hi everyone, my name is HanShu. I use she, her pronouns, and I'm an MSc Occupational Therapy student at the University of Alberta. Over the past year, I've been the members co-lead, and I'll be passing it over to Nina.
Thanks, HanShu. My name is Nina. I'm a medical student at McMaster University. I've been with the student collective for a couple of years now, and I'm currently part of the local initiatives team with Jeffrey, which has been very nice. And I think that's everyone. So I think I'll hand it back to Jeffrey.
Thank you so much, everyone. And now we're really grateful to be joined by the CISP team, the Canadian Institute for Social Prescribing tonight. CISP has been a huge supporter of the student movement here in Canada and also of social prescribing broader across Canada. So we have Srija here with us tonight, Senior Project Manager with the Canadian Institute for Social Prescribing, as well as Raisa, the Associate Communications Specialist. They are going to give a brief overview of just emerging social prescribing movements, what's happening across the country, and yeah, just going to be especially helpful for students who are graduating soon and thinking, where can I plug in? So I'll pass it to Srija.
Thanks, Jeffrey, and it's so nice to see such an exciting group here. And happy Social Prescribing Day to everybody. It's so wonderful to be with all of you today. I know it's late in the evening and so many of you are joining, so we're very, very grateful for that. For those of you who are not familiar with the work we do at the Canadian Institute for Social Prescribing, or what we call CISP, because it's just very long to say the full name every time, we are a national collective. We're anchored at the Canadian Red Cross, and our work is to advance social prescribing across Canada. And our role is to not run programs, but to help build conditions that allow social prescribing to grow and succeed in Canada, and which includes convening different partners from different sectors, including healthcare sector, community organizations, research and policy folks, as well as supporting implementation, building tools and resources, and advancing evaluation and evidence, and really helping create alignment so that social prescribing can scale in a meaningful and sustainable way in Canada. And over the past couple of years, we have had the opportunity to work with partners from across many provinces, supporting implementation sites, developing national resources. We also created space for people to come together and really talk to each other so we can hear from our partners from across Canada and internationally what they're doing and what has been successful in their stories and really learn from each other. And one of the most exciting thing we have seen is how quickly social prescribing movement has grown in Canada and how many different people in different sectors and different provinces are now involved in doing social prescribing. Um, it has been happening in Canada for some time, but really over the last 5 years, we have seen it scale across 8 provinces in the country, and you will hear more about it from Raisa later today. But it's just super exciting to see how much it has grown in the last couple of years. And that really brings me to the work that Student Collective is doing in this sector too. They're a really, really big partner in our work. And the energy that they bring, the leadership and the vision that the Student Collective has, that's just really, really wonderful. And they're just not talking about social prescribing within the student sector, but they're really moving social prescribing as a movement in Canada by talking about social prescribing in the academic space. They're creating programs. They're really educating people of what social prescribing is. So really grateful for the work that they're doing. So thank you again for having CIS team. So I'll stop now and I'll pass it over to Raisa to do an overview of what social prescribing is and how it has been expanding in Canada and a couple of the resources that we have had the opportunity to create. So I'll pass it over to Raisa now. Over to you.
Thanks, Srija. So hi everyone, my name is Raisa and I'm a psychology student at the University of Waterloo. And I'm also as Jeffrey mentioned, the Associate Communication Specialist for CISP. And I've been fortunate enough to have many opportunities to connect with the Student Collective, for example, talking about research and updates of social prescribing in Canada. I'll be doing a quick talk about the background and the current status of social prescribing in Canada. So could I go to the next slide, please? Thank you. I'm sure most of you have some idea of what social prescribing is, but just so we're all on the same page, I'm just going to do a quick overview. So social prescribing is a way to connect the formal healthcare system and non-medical supports and addresses the social and structural determinants of our health. It's not a new concept or a new practice, especially in Canada, and connecting patients with non-clinical supports has been happening informally for years. But social prescribing can provide a common language and framework to elevate the importance of this type of practice and enhance its reach and overall impact on individual health, communities, and health systems. So here we can see some of the core principles that act as pillars for social prescribing. Sorry, can you go back a bit? Thank you. So for example, it's evidence-based and approaches health in a holistic way. And social prescribing can offer a collaboration between health and social care, which creates a more integrated system. And social prescribing prioritizes and enables a person's ability to determine their own goals and take control of their well-being by a supported pathway, by asking what matters to you, and co-designing a solution with the participants and clients. Next slide, please. So the social prescribing pathway usually includes the components you see here, but models and approaches can vary depending on the community and social need being addressed. The starting point is with the individual or family who's experiencing some non-medical barriers to health. Their interaction with the health system, like a primary care visit, can be an opportunity for a social provider to see that they could benefit from additional support. They could then be referred to a social prescribing connector, also known as a link worker or navigator. It's important to note that there are multiple points of entry to social prescribing. Many social prescribing initiatives originate from secondary and acute care, rehabilitation, home care, and community sectors. In the next stage, an individual is connected to the link worker/community connector, and their job is to produce a personalized point of contact and co-produce goals and solutions with the client. They also provide supportive access to culturally and population-specific resources to help address barriers and advocate for the clients. Once the individual is connected to the various supports they need, they can then participate in a wide range of social interactions that will improve their well-being. The link worker then follows up to ensure that the goals and needs of their clients are being met through the services they were referred to. And finally, individuals and organizations work together to track these non-medical interventions, understanding the gaps, and to improve services and demonstrate the impact. Next slide, please. The social prescribing ecosystem operates across multiple levels. So at a micro scale, there are individual interactions. At a meso level or scale, which are the organization collaborations, and at a macro scale in terms of policy and system level frameworks. There's a complexity and interdependence between these relationships. Next slide, please. So in Canada, the social prescribing journey officially started in 2018, and a pilot project in Ontario was held by the Alliance for Healthier Communities, and it was demonstrated so much success and attention that other stakeholders in Canada began to adopt similar practices and framing. And as you can see on the map, 8 of the provinces in Canada have social prescribing initiatives. An example is that our partners at United Way BC have implemented 100 social prescribing community connectors across their province, with a particular focus on older adults. Next slide, please. So in terms of the provinces, in BC, the social prescribing movement builds on existing efforts to link health and community care, such as the Better at Home program. In Alberta, social prescribing started with private funding and is now funded through the Provincial Ministry of Assisted Living / Healthcare. And there are 21 organizations that have social prescribing across the province. In Saskatchewan, there are 9 sites that are running social prescribing, and a 10th will be added soon, close to the US. The movement is mostly led by the Saskatchewan Seniors Mechanism. And as for Manitoba, they started with a network of senior resource coordinators and are led by the Manitoba Association for Senior Communities. Next slide, please. In Ontario, there are several initiatives in health teams, such as St. Michael's Family Health Team in Toronto and the Alliance for Healthier Communities, who have 60 sites with social prescribing pilots. In Quebec, they've already connected services with nurse practitioners, and healthcare already connects with community organization. Now the focus is on how to support this in other regions, not just urban Montreal. In Newfoundland and Labrador, 40% of the population is over the age of 50, so there's a high demand. 93% of the referrals come from the healthcare system, as social prescribing is embedded in their healthcare. And last but not least, in Nova Scotia, the Wellness Navigator role has existed in primary care for over 15 years, and the social prescribing movement is currently led by the Nova Scotia Health team. Next slide, please. So there are many resources about social prescribing in Canada on the CSP website, so you can go to socialprescribing.ca if you want to learn more. For example, we have an asset map which shows different groups that participate in social prescribing around the country, which you can see on the left there. And we also have information about social prescribing works and its training in the roadmap. We also have different fact sheets, and this one in particular about the mental health of children and youth may be of interest, as a lot of us are students. As soon as we'll be putting out a link to our competency framework, where there will be more information about what a link worker is and the process of being a link worker will be provided. And then next slide, please. And that's all from me. Thank you for your time, and I'll turn it back to the student collective.
Thank you so much, Raisa, for that comprehensive overview of what's happening across Canada. As you can see, there is a lot of growing interests. Okay, so now we'll pass it over to Tara, who is a PhD candidate at the University of Waterloo.
Hi everyone, happy Social Prescribing Day. I am at the University of Waterloo. I actually had a great time today at one of the courses where they were showcasing different undergraduate capstone projects where they were trying to develop social prescribing interventions. So not related to my project, but I will give a quick overview of some ideas maybe for yourselves to think about research. So, as Jeffrey mentioned, I'm a PhD candidate in health geography. So, under the Faculty of Environment, my vision is everything and everywhere is public health. So, my supervisor is Dr. Susan Elliott, as well as support from Dr. Kate Mulligan and others. I was really intrigued by this idea that we were seeing in the news, people getting prescriptions to get free access to parks, as well as different prescriptions for nature walks or bird watching classes. So my focus is on what I call nature-based social prescribing. So that includes all the green prescribing, blue prescribing, and park prescriptions. And my focus is on Southern Ontario. So I'm really asking one of the early questions. what exactly is happening? How is nature-based social prescribing being implemented and experienced in Southern Ontario? And it's important to kind of go back to the very beginnings before we get into the nitty-gritty because we still needed a baseline understanding. So specifically, I'm really thinking about these relationships and systems that make these programs possible. I focused on qualitative interviews with stakeholders. So in my study, I looked at prescribers, so any healthcare or trusted care professionals recommending nature-based activities or just simply spending time in nature, looking at the conductors or link workers, how are they navigating it, and the organizations, specifically those who are stewarding nature spaces. So the conservation authorities, park organizations, community groups that are hosting nature-based activities. So through these qualitative interviews, I was really asking, okay, like, how are you implementing it? Do you call it nature prescribing, or do you see it under the umbrella? What motivates you? What are the challenges? And it's not new. You might have heard of it. A lot of the research is highlighting the structural challenges of transportation, accessibility to nature spaces, awareness, time, infrastructure, and partnerships. On top of that, I also just finished one of my studies where I interviewed patients through walking interviews because I thought, what better way to understand the benefits of nature prescribing than simply being out in nature with them? So this is a map of where I traveled to. I met different participants who I self-identified that they had received a nature-based social prescription, and we took a walk in nature to ask them about their experience, about the prescription, referral process, and simply how it made them feel. So that was really unique, and I kind of lived in my car for that. So just to show you that there's so many different ways to engage with research at the master's, undergrad, and doctoral level. And if you are interested, feel free to reach out to me. I'm always happy to share my experience as a grad student. So I'll go back to Jeffrey. Thank you.
Thanks so much, Tara, for sharing that. Yeah, nature prescribing is certainly one of the growing fields inside social prescribing. So thanks so much for that. Now we'll pass it to our very own CSPSC Medicine Working Group. And yeah, just to give us some updates about their group. And they also have a new paper. Mackenzie just sent me that published today. I'm just going to put it in the chat here.
Yeah. Hey everyone, my name's Azeria. I am a medical student at the University of Alberta, one of the junior co-leads this year of the CSPSC Medicine Working Group. The co-lead, Emmy, she's a med student at McMaster, was hoping to be here today, but she did have a shift. But we also have our research team lead, Nikoo. Can you introduce yourself quickly?
Yeah, great to be here. Thanks everyone. My name is Nikoo. I'm a third-year med student at Queen's.
So we can go to the next slide. I'll just give a quick overview of the medicine working group. So we are a medical student group that is working towards integration of social prescribing into medical school curricula and into the Canadian health system. So we're doing this through research, events, education material, different advocacy initiatives. And we currently have about 60 medical students from 12 medical schools across Canada. Next slide. So just to run through kind of some of our current events and projects, starting with our advocacy team. Our advocacy team, their main focus is running our speaker series. Over the past 2 years, we've held virtual or hybrid events with different people who are working leaders in the social prescribing space. Most recently, this past week, we had our session on social prescribing and immigrant health. And that was with Dr. Lita Cameron, who's a family med doctor in Hamilton and the global health lead for the McMaster Department of Family Medicine. And this past December, we had our session on social prescribing for Indigenous populations. And our speakers for that were 2 LPNs and Indigenous health liaisons, Darlene Dolby and Jess Hayden. And we also had a social worker with the Indigenous Health Liaison program as well. So it was also a really great session. And that's just the one on the side there. I have the links to all these things that I'm going to mention, and I can put that in a chat if anyone's interested as well when I'm done. And our next upcoming speaker series is going to be Social Prescribing for Seniors. And that's going to be with Joanne Schroeder, who's a recreation and tourism professor at Victoria Island University. And she's also the chair of the World Leisure Organization. So that one is in the works and going to be coming up soon. Next slide. And then onto our communications team. They work closely with the advocacy team to help promote our speaker series and other projects and events. And we've also recently launched an Instagram for the medicine working group. So excited to continue outreach and be able to reach more medical students through that. Also have the links for that if you want to share with enough students that you know. And we'll go to the next slide, and I'll pass it over to Nikoo for our research team.
Thanks, Azeria. So the research team really started with the idea of wanting to explore the intersection of social prescribing with a lot of different things in medicine. Specifically, first, we were thinking about medical education, and that's where our study that I'll talk about later came up. But in the meantime, we've been working on review papers and commentaries around pediatrics, substance use, as well as emergency medicine, mental health. So here are some of the titles that you see on the slide. Actually, one of them got published today, the one that Jeffrey thankfully shared in the chat. And then I also added one about pediatrics there as well. So I'm very excited to share that with you all. The study that we wanted to do with the medical student from an educational perspective is in collaboration with CSPSC. So really, really thankful for their support. And we're basically hoping to send a Canada-wide survey to all medical students to really assess their perspectives on social prescribing and how they think they will be using it down the line. So I'm excited for that as well.
Thanks, Nikoo. And finally, we have our education team. So one thing they've been working on is converting all of these amazing research projects, once they're published, into kind of one-page infographics that can then be shared with various places to help kind of reach the intended audience and just make them more accessible. So on the side here, we have two of our recently completed infographics that are for the papers that were published over the past 2 years. So these are currently going out to medical schools and doctors' offices and things like that to kind of expand that reach. And the education team has also been working on some modules that can go to medical schools to be potentially integrated into curriculum as well. So that is really exciting for us as well. And yeah, we'll just go on to the next slide. I've put our email here if you have questions, suggestions, love to hear from you, and the Instagram is there as well. And then on our page on the CSPSC website, we have some of our previous speaker series, as well as links to some of the published research projects as well. So back to Jeffrey.
Thank you so much, Azeria and Nikoo, for sharing this work. And as you can see, there's broad relevance in social prescribing to medicine and in many different specialties as well. You can just see from the journals that you've published in pediatrics and family practice and public health. So yeah, if anyone's interested in getting involved, yeah, look at the links here for the CSPSC Medicine Working Group. Yeah, and they also just posted the different channels, social media channels in the chat. Thank you, Azeria. Okay, so now we will pass it over to our other working group, the Research and Knowledge Translation Working Group. I'll pass it over to HanShu.
Thanks, Jeffrey. And it was so lovely to hear about all the work that everyone's been doing in social prescribing. So I feel like the scoping and review, which has been years in the making, kind of encompasses all the amazing work that everyone is doing to really see how students are involved in social prescribing. I'm presenting on behalf of our team. So Caitlin Moll, who actually came up with the internationally accepted definition of social prescribing, has led this study. And I was also joined by Sarah, Tarek, Stephanie, Baha, and Dr. Daniel Hayes, who really helped us bring this study together. So our aim for the study was to kind of really understand the types of evidence that is available that describes social prescribing and students, and to also understand the knowledge gap in the evidence around social prescribing and students. So we have published our protocol and we submitted the manuscript for publication actually this morning. So the manuscript presents to our knowledge the first comprehensive scoping review mapping the global evidence of social prescribing in relation to student populations. So while social prescribing has been expanding globally, which is so lovely, research has largely been focused on adult and primary care populations. The role of students as the future workforce are said to be active contributors to delivery and will benefit social prescribing, but the population remains to be understudied. So what we ultimately found, so this is very preliminary, out of all the databases we searched, we included all studies that classified students as the population, so there wasn't any age limit. And out of them, 9 studies discussed students to be delivering social prescribing. 4 studies describe students to be learning about social prescribing formally and informally, and the medicine working group will really help with that with the modules that they're developing. The other articles we included discuss student perception and awareness of social prescribing, students acting as the social prescription, and the students being the recipients of the social prescribing initiatives. So I'm really excited for the paper to come out, and Sarah, our lead for the research working group, isn't able to make it today, but I'm just really excited to see all the amazing work that the working group produces down the line. And back to you, Jeffrey.
Thanks so much, HanShu. Much to celebrate today. We have a new paper published and a new one submitted today. Just all CSPSC work. So congrats to everyone. And next, we will pass it over to Élyse McCall-Thomas, who is also a co-lead of the Student Collective and a PhD candidate at Ottawa.
Thanks so much, Jeffrey. And just to echo what HanShu was saying about how wonderful it is to hear about all these initiatives, I'm sharing a little bit of a project that I had the privilege of working on a little while ago. And so I am presenting it, but I just want to acknowledge that I was just one member of a bigger team. So the project was led by Tim Aubrey, and I worked in conjunction with Christina Mutchler, Minda Wood, and Aghaei. So we were involved in a project called Developing a Community Building Intervention for Housing First Clients. And so the way that we describe community building intervention is really, sorry, do you mind going to the next slide? Sorry, thank you. So community building intervention or just community building, as we describe it, by combining social prescribing and the notion of citizenship. Social prescribing taking sort of the biggest focus of that equation, but just recognizing that the citizenship component for us, at least for our project, was also a really important piece, and that these two aspects really go hand in hand. And the hope is really that by integrating social prescribing into Housing First programs, we'd be able to connect clients from those programs with the community to help them access resources to meet their needs. So here we say social needs, but what we found through the project was needs on a whole various a wide range of areas, social, but also health and financial and other areas as well. We go to the next slide. So just very quickly, just to kind of give a high-level overview of what the project looked like. So we started with sort of a developmental or evaluation, or like a needs assessment to identify the needs of clients. We developed the intervention, we piloted it, and then we took the findings to really think about how we could take what we learned to allow Housing First programs to implement this type of intervention on a broader scale. And so what I'm going to share with you today is just part of our knowledge mobilization strategy, and specifically the toolkit that we developed as a result of this project to help organizations like Housing First, but others hopefully can take this and translate it to their organization and teaches them on how to bring in social prescribing or social prescribing intervention into the work that they're doing. So we go to the next slide. This is just a brief overview of what the toolkit looks like. At the end of the presentation, I'll share my email address. So if you want a copy of the toolkit or have any questions about it, just because I'm going over it very quickly, please feel free to get in contact with me. So I'll just share a couple of aspects of the toolkit. So if we go to the next slide, just kind of give you a quick overview. So this idea is it can be used by like frontline workers, managers, administrators to really, again, think about how they can integrate a social prescribing intervention into their program. So for us, what we did with the toolkit is we shared how we developed the intervention, and we gave actual tools as part of this toolkit. So documentation, guidelines, things like that that could be used to integrate the intervention at different levels. So really just a step-by-step approach on how to do that. So one thing that we included as part of the toolkit is a community asset map. So this one is only for Ottawa, based on where we did the project, because we worked with 2 community-based organizations here in Ottawa. But we gave a link to it so that people could kind of see what that community asset map looked like. And my colleague Minda did a fabulous job, and there's probably hundreds of different organizations and activities that clients at Housing First could look at and choose from, thanks to this community asset map and where the locations of these programs were in relation to where they live, to make it more accessible, and hopefully they can find things that they were interested in that were in their community. So other elements of the toolkit, so we're community building sessions. So how case managers can work with clients to share, like just to speak with them about what social prescribing is, but to share then how they can, clients can sort of think about how they can go about engaging in social prescribing in a way that was accessible. And that took a stepwise approach that wasn't too much too soon. For some people, it was a lot to really think about getting into the community and starting to put themselves out there right away. So sometimes there's a stepwise approach on how to do that and allow people to get comfortable with the idea before actually engaging with their community. So in addition to the community building sessions, we also shared information on, sorry, I can't remember what's on the next slide. Thank you. So the community building group. So this was something that we had with clients, where we brought them together at different times throughout the implementation of the intervention, usually over like a lunch period, so we can offer them some lunch, and we would have informal discussions and ask them how they were feeling about the notion around social prescribing, what they were doing in terms of engaging in their community, what could further facilitate their engagement in social prescribing, and what kind of barriers that they were experiencing. So we could try to work with them to find ways of addressing those barriers, but also so that we and case managers could learn how we could sort of improve upon those circumstances and try to find more facilitators towards engaging in social prescribing. We also had a community practice for case managers, kind of along the same lines, so that they could share with each other and learn from each other about what are the challenges that they were experiencing when it came to integrating social prescribing into their programming, who was being successful and what they found to be successful, and what we could, again, do to try to facilitate this. We would find there a lot of challenges, for example, around finances, the cost of engaging in some activities, and that was a barrier for how that could be addressed, and who we could work with or leverage in terms of community partners in that respect. And then the toolkit also provides some tools around how you can evaluate community building or your social prescribing interventions. So some measures, indicators, things that you could do to know, are we doing well? Do we need to adjust? And what does that need to look like? So I think that might be, yeah, the last slide. So if you have any questions, please feel free. Again, this is just a very high level overview. The project is much more nuanced and complex than that, but I just wanted to highlight that this toolkit does exist in case people think it could be interesting or useful for their research or their work.
I think this is a good transition to the Q&A portion as well. For Élyse, there is a question in the chat from Nikoo that says, the asset map is so great. I was wondering, in your experience, what's the best way to keep these hubs, maps, databases up to date?
It's a fabulous question. If anybody also has ideas or has experience, I'd love to hear, because that was something that we found really challenging, and something that we spoke in length with the 2 organizations that we were working with, because these activities and services are constantly changing or evolving. So my colleague who was responsible for it was updating it on a fairly regular basis. But of course, when the project ends, and she's busy doing other things, she doesn't necessarily have the time. So we were in conversation with one of the organizations who I think has picked that up, or is hoping maybe to pick it up. But we haven't really found a way of automating it or doing anything that would require less work than somebody just manually updating it. There are opportunities to do that, but I think the cost and the time has been a little bit prohibitive. So if other people have experience or suggestions, it would be really welcome, and I would love to pass that on to the organization.
Margaret, do you have any thoughts on like experience with 211 and how that's maintained?
Yeah, thank you, Jeffrey. And it's so amazing what you just shared, Élyse, and there's so much work that went into it, and also a really interesting question because it's really such a problem to keep the asset map up to date. The ones that I saw in BC is so there's a database called 211, and their update is, I believe, every half a year, every year as well. And how they do it is they would reach out to each organization that is involved, which is several hundreds or even thousands, and to ask them, do you have any update that you would like to share? And I know a similar method is also used for another platform or for primary care providers to find information, that it's either kind of a recurring prompt at quite a long time to say, any updates you'd like to share, or another way is they build it into their map or website, to encourage the organization that whenever you have something you want to update, come here and click this button and update it for the team to receive it. So none of them sounds exactly technically like technology fancy. So I think it's really about, from the ones I learned, is about building that structure and reminding people to update, because sometimes the change is so much faster than we could imagine. And even a small change like a phone number or something can really impact how the person accesses the resource. So those are two ways that I saw. I would love to learn other ways as well. Back to you, Jeffrey.
I'm seeing some good discussion in the chat, and if anyone else has questions, feel free to drop them in there. In the meantime, I do have a question for everyone who spoke today, as well as anyone else who's in attendance and would like to answer. I'm just curious on, considering all of you are doing such excellent work in terms of research, and then the medical students are doing amazing work as well on the advocacy side, in addition to the research side. I was wondering where you guys see yourself taking social prescribing in your future careers, whether that be continuing research or incorporating into your practice. And I guess what about the future of social prescribing excites you and makes you want to keep doing this? And the floor is open to anyone, and it was a big ask, so take a second to think about it, maybe.
I can go first. So I've been part of the research working group since I found out what social prescribing was during a first-year undergrad course. And to me, social prescribing has always been about belonging. So as someone who's studying to become an occupational therapist, we learn to take a really holistic view of all aspects of our patient's health. And outpatient OT services are generally not covered by universal health care. So maybe one way that I want to incorporate it into my everyday practice is to really refer patients to social prescribing initiatives in their community to really lessen the barriers to care, while also having them partake in non-medical activities that can relate to their ADLs, for example, to really help with recovery, even if they're not able to afford outpatient OT.
Yeah, that's wonderful, HanShu, especially knowing how important OT is and how much work they really encompass in our healthcare system. I do feel like it's a bit of an oversight that hopefully will be rectified in the future. And I think you're right that social prescribing could have a strong role in helping with that. I can go next. I personally really see myself working in family medicine. And when I grew up wanting to go into this field, I always thought of being able to provide all-encompassing services, meaning that I'm able to connect people to community supports when that is the better option than just a prescription. And I think that's why all of us are interested in social prescribing. So I'm really excited by the idea of hopefully by the time I get into clinical practice, there will be options for workflows that integrate social prescribing into our day-to-day, and that I'm able to provide patients with that support, because I've seen firsthand how unofficial social prescribing can be beneficial for people. So it'd be nice to have it even further recognized by our healthcare system and utilized that way. And the floor is still open if anyone else would like to add on.
Maybe it might also be a bit of a question, because I think so I mean, how I found out about social prescribing was really a happy accident. I was asked to be a part of this project, and then I found out what it was and learned about it and loved it. But my current work does not necessarily center around it. But I have the opportunity to work with a lot of community-based organization. I focus on building their evaluation capacity. So sometimes it's just even in a more formal way, where sometimes I think social prescribing might align with the type of work that they're doing. Again, if it's like a health-based community organization or one focusing on social services, just based on the experience that I have. So just even being able to bring social prescribing to people's attention, and a lot of people still really don't know about it, especially at that sort of community level. So I appreciate that opportunity, but I guess part of my question is if other people have suggestions or experiences on how that might be more intentional or less maybe informal and formalized. I'm still trying to sort of figure that out, given that it's not necessarily exactly part of something that I'm focusing my work on.
Not really to answer the question, Élyse, but one thing that along that line of thinking, one thing that we keep hearing from folks is they think they're doing social prescribing. There are components of social prescribing they're doing, and they want to lift it up. So I think it's really important to recognize that social prescribing does not have to mean that it has to be the full pathway. There could be light touch social prescribing. It could just be an intentional collaboration between the healthcare provider sending a referral to a community organization, and there is a link worker who's connecting the person to non-clinical supports and services, and that's it. A very simple pathway. It's just an intentional way of having capacity to support the non-clinical needs. So really helping organizations to recognize that it doesn't require a lot of setup. Social prescribing can just start wherever you are at right now, and it's really recognizing what is it that you're already doing that are in parallel to a social prescribing pathway, and how can we lift those up and really amplify those pathways a little bit, and to your point, creating awareness of the fact that this kind of pathways exist and there's way to support people through these pathways. So that's really to amplify the work that's happening is really important to me in social prescribing.
Thanks, Srija. That's a really good point, and really important to keep in mind as well. I think it's easy to get caught up in the fact that it needs to be this formalized, very structured way of going about things. But I think we all know that social prescribing as a concept has been around for way longer than we've assigned the word to it. So it's important to have that recognition. So thank you for that. If no one else wants to answer that question, another question we have is just any challenges that you guys maybe have experienced in the scope where you practice or are researching or advocating for social prescribing, and maybe some ways that you're thinking of overcoming those challenges, have overcome them, or maybe you can pose them to us and we can discuss together what we think would be a good way to go about that. It's also open to anyone.
Yeah, thank you. I think I just want to echo what Nikoo said earlier in the chat as well in terms of that, because yeah, she mentioned that there are programs that are kind of at capacity. There are people referred to services, but they're not able to use it. And I worked a little bit as a community connector link worker at my local like senior center as part of like the BC kind of social prescribing pathway with Fraser Health. And yeah, a lot of times like we like tell them something and then they call back and say, oh yeah, this actually is not happening anymore. So I think that is definitely one of the biggest challenge that I think a lot of us have mentioned, like keeping those databases up to date and knowing like what actually helps the participant in that pathway is always the journey to like learn how to learn what their needs are.
Just want to echo what Jeffrey you just shared there too. And I guess this is more related to the first question, Nina, but I think social prescribing in a way, like you said, has been around for a very long time and is practiced, like she just said, it's practiced in so many different ways throughout the world, throughout Canada. And I think in addition to a pathway, it is also a lens, like no matter where we are, to really recognize who is this person that we are with. So what matters to them and how can we really thrive together? So not just using, like not just seeing them from one side, but are we willing to take the time and can we take the time to explore this person, kind of the whole person or holistically, as they like to use in healthcare education as well. So how can we share the time to get to know this person and also acknowledging that yes, there's a lot of resources out there and a lot of them are at capacity. But are we willing, as I guess for myself as a nurse or for anyone, are we willing to learn about what is out there even? And even if isn't at capacity, are there other ways that we can self-support this person? And I learned that every single day from the connectors in BC that there are, even when the program is at capacity, it's not that they will push the boundary or anything, but somehow, some way, there's always some way for them to find a solution to leverage the power of the community that we might not even recognize is there. So for example, one of the really amazing stories from like community Facebook groups. Like you wouldn't really think that, oh, that's where actually social prescribing is happening, but it is, and it is all different people coming together to support someone. So I really think it is a lens that is not just between you and the person who maybe you're interacting with, but are you yourself willing to take that time to understand them and to reach out to learn for yourself on what is out there? So I think there's a lot of ways to implement social prescribing, whether the program is available or the pathway is available or not.
I
Thank
think
you,
that's
Margaret.
oh, sorry,
Oh, sorry.
Nina.
No, go ahead, HanShu. I was just going to say thank you to Margaret for her great words.
Right. I was gonna say the same thing, like Margaret, that was so well said, and it reminded me of something that I saw. I think it was on LinkedIn today where someone posted a report or a paper about how libraries could also be a site for social prescriptions. So it really comes down to like really understanding what kind of like, I guess, social needs the person wants, and then kind of like finding ways to like incorporate aspects of your life into social prescriptions. But I think you said it a lot more beautiful than I did. Um, does anyone else have anything to add, or I feel like that's a really great way to conclude our celebration today? Okay, well, thank you everyone for hopping on today. The CSPSC leadership team will stick around for a few more minutes if you have any more last minute questions. Otherwise, have a great rest of your evening. And if you ever want to connect with us, we'll be happy to connect on our social media or point you to the right person to contact. So thank you again, everyone.